All right, let me just pull up the agenda here for a moment. Unless, Jim, do you have the agenda already loaded up?
Everything's loaded up on there for you and you're ready to go.
Okay, so we'll get started at
6:03.
6:03. All right, I have, it's a roll call. I have Gloria here in the end.
I'm here.
Gloria, you're here. Gloria. Yep. Glenn, Tori. Glenn, are you here? I thought I saw you. And I see Matt on there.
Yes, I'm here.
Okay. All right. Yeah, I got you. Oh, no, I said your name. I told him your name. So. All right, so public participation. As you can see within Zoom, you raise your hand if you'd like to participate. So I'm calling out for anybody who interested in saying anything.
At this point, we just have the one attendee that we released before, John. So
Okay.
if he's interested.
Well, he's part of the panel, so
Yeah.
So that's fine. Okay, we can move on. Review and approve of previous minutes, which were sent out a couple of weeks ago. Motion to approve.
I'll approve.
All right, second.
A second.
All right, all in favor?
Aye.
All right,
Aye.
all right. So 4.1 public awareness. So I've been trying ever since I became chairman to kind of get us more out in the public eye. This virus and us having to do virtual meetings is kind of something that's kind of helped it along a little bit, because we can have people that actually might not normally know about these meetings come join us virtually and ask questions and be informed. Does anybody, I know a couple of people had a couple ideas about getting us out into the public TV and such like that. Anybody want to expand on that or have any thoughts on that, on how to get us more out there in the public?
Well, I had mentioned to you, Dan, if you work with, because some folks are probably watching public television more, if we could work with something with NCTV and like a monthly EMS report, or how does the system work, or something. You may not get a lot of viewers, but you'll get some.
Okay. Yeah, the only thing we have to make sure that is that people see EMS and they call in with I got a pimple right there, what does it mean, type of stuff, which we obviously want to avoid. But barring that, yeah, we'll look into it.
Or a monthly segment on public education along the lines of give a vial of life, or something similar to emergency management does.
Okay. I'm sure we can work with the local EMS services for that as well. Anybody else?
Yeah, I'd like to take the puck here.
Sure, go ahead.
All right, so adding to Glenn's thing, I've had a few times over the past, especially during the COVID times, community TV approach us about doing exactly like Glenn's suggesting. It's just a matter of putting together some topics and doing it, because again, as they're using the community TV, the normal programming, a lot of it, they've had a change and they're looking for topics. So I think they would be really receptive to this. And it's just a matter of getting some ideas together and things we can talk about and keep it kind of brief and short. And I don't know what you think, Glenn.
Well, from some of the stuff that I've done, one of the agencies I work for, they have, when we do disasters, they'll actually have a production crew and do public awareness. We did that during Katrina, but that was for that specific event. But what it does is, you get what's a boil your water order, or, do you have your medications if you have to get up and go real quick? Do you have everything that you need? What does it mean when they say 2 weeks worth of your stuff? That's something, I don't know if you could do a stop the bleed virtually, because that's involves hands-on skills, but something along a virtual first aid, get some involvement. There's plenty of public education topics that are out there.
I have a question from Gloria.
Glenn, it's Gloria. I really
I-
think that's more core related than EMS committee related. I mean, I totally agree with what you're saying, but I don't think that's anything the committee should be doing.
That was low audio. I couldn't hear that. Sorry.
She's basically saying that sounds like something that should be handled directly by the town agency, or in this case, Newington Ambulance, and not necessarily the committee.
Well,
Our charter is public awareness, so it kind of does fall into our responsibility in a way. Obviously, having Newington Ambulance and even AMR, if they want to participate, would be ideal, because they're the one that actually provide the service in town. But it's something that maybe we can initiate.
We could sponsor something.
Yeah.
Well, yeah, I mean, not necessarily. I mean, the committee doesn't necessarily need to do the education. It could be one of the two services or both services working together. The agents, the committee itself could, whether they'd be interested in a public television. Hey, maybe not monthly, but quarterly. This is what EMS has done in your town. These are the calls that have gone on. And, this is the amount of, just give them an overall, because unlike the fire service, they've always been good at public education. You see Fire Prevention Week, but you never see Injury Prevention Week.
All right, we'll definitely look into it. I'll talk with the chief, Newington Ambulance, and I'll reach out. I'm not sure Brandon is here or not, with AMR, and see if we can come up with something, and we'll talk about it again during the next meeting. Nothing else. 4.2 town agencies report. Nothing to report from other town agencies as of now. We'll get into the specific stuff with the other bullet points, unless somebody has something in particular. James, if we could move on, please. Old business. So reports from American Medical Response. The committee members themselves should have received reports, the monthly reports for everything, I believe, up to last month or October, for review. So basically, those that are new here, we do get reports from AMR with response times, and if they meet the criteria, and if they don't, they garner a fine if they don't respond within a timely manner. And reviewing them, does anybody have any committee members have any questions or concerns about anything that they saw in there? I took a look myself. I didn't see anything particularly bad. They're still up there in the high 90s as far as response times, which is very good. Hearing nothing, moving on to Newington EMS. So I do not have any data from Newington EMS. In talking with Chief Mangan, he's waiting on the the town or the dispatch, send him some data. So that he can give a proper report or send us a proper report on times and such. Chief Megan, do you have any comments on that?
Yeah, I mean, again, looking at, basically, if I just look at response times, nothing really pops out at us. The one thing that we've been missing for at least 10 years now, and through 3 different contracts, I do have to say that American Response has done very well with pushing forward with getting the data links up and running with the town. It's taken 3 contracts to get it. And one of the hopes is that what's missing right now, for those that aren't familiar with it, is when a 911 call comes into Newington, our public safety dispatcher takes the basic information, starts first responders, which is the police department, and then they send the information on to for emergency medical dispatching. The emergency medical dispatching takes the further information about what the 911 call is about. If the patient's not breathing, there's some first line instructions given, and they can even go as far as to have someone begin CPR over the phone. That's handled right now outside of Newington PSAP, or the primary service answering point. And so that's handled by American Medical Response. And then they can talk back to our dispatcher, but they're staying on the line with the patient's family or the call where it's taken place. But there is no data link. And that's something that's been worked on for many years. And I do have to say is that I believe we are the closest we've ever been. I know Brandon's listening in. I don't know if he can join in. He could be in the middle of a call, but we are very close to getting that done. I've been working with the public safety dispatch team, and they're putting together their codes to get the stuff done. So what that will give us is not only the phone, listening to the phone information, as the call is inputted into the computer, it's automatically sent back to dispatch. This is what happens with fire calls right now, is that when the fire department's called, they can actually talk from dispatch through the computers that the chiefs and the fire apparatus have, so you get the pertinent information. That does not exist for EMS. It was supposed to exist. It's been blocked by the town numerous times over the years because of security with the IT. But I do have to say we are very close. Once we get that link doing, then we'll have information that we can actually put together a very meaningful report. Right now, the only thing we can get out of dispatch is they could take and basically send over PDF forms, and then we have to manually enter all the data. So the data link is going to be critical when we get that up and running, and that's coming. It's just, I think we're the closest we've ever been, and I know that talking with Chris Chaplin and Brandon, we're pretty satisfied with the progress they've made in the last 6 months on this project. So hopefully we'll be able to give you more detailed stuff in the future.
Okay. Yeah, I know
Just-
you've been working on it. Brendan, do you have something?
Yeah, just an update on that. So everything is all set and has been ready on the AMR side for quite some time. I believe the town is ready to go. The last thing we're waiting on is NextGen, and that's the vendor for the CAD that the town of Newington uses to complete that link, which we have for other municipalities. So we're just waiting on NextGen, but we are very close. I would anticipate it hopefully before the end of the year, if not January.
Okay. Is there anything we can do to move that along, or we just have to wait for NextGen to?
I believe no, we're just waiting for NextGen. My IT department and communications director has reached out to them, as well as officials from the town of Newington. So we're moving right along.
Okay, excellent. Thank you very much, Brendan.
I know it is an ongoing project that on the PDN, which runs dispatch, has been working on, and it's still in the works. On a side note with that, as you know, Gary Bolio has been our senior public safety dispatcher. He has received a conditional offer from another service, and he's due to retire soon. So one of the hurdles we will have with things like this moving forward is just a slight transition between another person will head projects like that, which most likely is probably going to be Russell Garuti.
Cool, excellent. All right, and actually on that note, we do have our own personal, I guess, promotion. One of our committee members, Gloria Olson, has been named president of Newington EMS, so congratulations, Gloria. All right, so those are the reports. If there's nothing else, we'll move on. I know we got a couple of things to discuss. All right, so 6.1, Payne Road incident. So a few weeks back, several weeks back, we had an incident on Payne Road here in town. And not to get into the details, but it was a motor vehicle accident. And it took roughly, I have the times here somewhere, roughly 25, 30 minutes for an ambulance to arrive on scene. So obviously this raised a couple of red flags. And we kind of had to all kind of look into it and see what happened. And if any one of the parties involved in looking into it want to add something, please feel free. It was just one of those situations where it was a perfect storm and everything kind of gelled the wrong way together. But out of that, we are hopefully trying to find new ways to kind of make improvements. So then it happens less and less. It doesn't happen very often, maybe once every few years. Like I said, you get that perfect storm of stuff happening all at once, and there's some sort of delay. Nobody's really at fault. It's just the way the universe works, I suppose. But does anybody have any comments they want to make on that incident?
Dan,
Yep.
okay, when you initially talked about this call, you said when the call was transferred down in Haven Communications, the call wasn't passed along to from offgoing to oncoming dispatcher, which may have contributed, one of the multitude of factors that contributed to the delay?
Yeah, something like that. Brendan, if you want to chime in, I know you sent me that report that there might have been a slight delay with shift change at dispatch. Is that correct?
Yeah, I believe there was a few things going on at the time of this emergency. There was multiple active calls in the system. I believe Newington Ambulance was offline that night at midnight for staffing, so we were providing dedicated ALS coverage. That crew was being assembled for the midnight to 06 coverage. It was right around the time that this call came in. I believe there were multiple requests for ambulances for this accident. And during the dispatch of one of the units, there was a shift change, and the offgoing dispatcher didn't relay information to the oncoming dispatcher that contributed to the delay. So there was a human error there that was investigated and dealt with appropriately as far as contributing to the delayed response.
Yeah, I believe also the Newington EMS were on a call as well, so they were not available to respond to that. But yeah, like I said, it was kind of like a perfect storm of things happening all at once. I don't know if Chief Megan, if you have any comments.
I mean, when you look at the numbers, I don't know what the real numbers were. Brandon may recall, but I think this was like the third or fourth call in town at the time. I know Hartford was blowing up with a bunch of calls also. So again, when you look at it, I think it was overall, once it was identified locally by Brandon's staff, the ambulance was dispatched real quick and started heading down to it. And then our crew was able to basically clear the hospital in extremely fast time and head back. And I think the two crews arrived almost simultaneously.
Yeah, I believe so.
So it worked out in the long run. Not ideal, but it's not a situation. It's just there was so much activity in the area at the time that it's just one of those deals where it was poor luck. And but overall, I think it worked out well. I think the follow-up from the agencies was good.
it was, yes, SOS, I want to say it's absolutely very good.
Yeah. So,
Right. I mean, it happened several years ago. I remember it happened. It's just, it doesn't happen often at all. So like I said, both agencies do a very good job responding to calls. It's just, this happens. Was there some human error? Yeah, but there's always, that's expected sometimes. But as long as we can improve it and kind of narrow that gap to make sure those type of things don't happen. And I think both agencies have done that very well. If there's no questions on that, so Mr. Torrey, if you want to, do you want to spearhead this, or do you want me to get it started for you?
I'll go with it. The
Okay.
question is, did we get Hartford and St. Francis folks on?
Yes, they're on. If the so their involvement with the fire rehab, they should
Yes.
be. Yeah, Mr. Quinlaven should be on. I believe Dr. Johnson on, and Dave.
Okay, the big question I have is, which one of the two hospitals provides medical oversight for Hartford Fire Department?
I do. Hartford Hospital.
Hartford Hospital does. Okay. Are you familiar with Hartford Fire's rehab protocol?
Yes.
Okay. In 2017, Newington EMS was informed by medical oversight that they had some issues with the way that rehab was provided here in town. And I guess the issue stemmed around the taking of vital signs. Now, if you look at Hartford Fire's protocol, it's much more involved than what Newington had at the time, right down to specific things where it comes into temperature of the patient or the firefighter being seen, and levels of PPE removal and return to duty. Between 2017 and now, some things have changed. There's a new standard out there called 1584 from NFPA, which specifically references fire department rehabilitation, where it sits in the EMS system, and what should be done. The question is, what was the issue with the taking of the vital signs? Because as far back as 92, when they instituted rehab per 29 CFR 1910.120, which is, pardon me, the standard for rehab that has to be provided for hazardous material operations. And then U.S. Fire Administration came up with emergency incident rehabilitation. They've always touted that firefighters go in, they get an initial vital signs check, they're monitored over time specific, and then they're checked again to determine return to duty. What was the heartburn?
So just to clarify, so I'm Charles Jandro, I'm the EMS medical director for Hartford Hospital, if we haven't met before, but I don't think there was a quote unquote heartburn regarding the protocol, but more the fact that vital signs, especially blood pressure and heart rate, are probably not the best way to determine whether a firefighter should be going in and out of the fire ground, and got, the focus became more on hydration, cooling, supportive care of the firefighter on the fire ground, as far as I understand it. So,
Oh, yeah.
Dr. Chandra, I think we lost your communication for a second.
okay. I'm not sure what piece you missed, but it was just trying to get away from specific vital sign parameters, as they may not be the best indicator of firefighter health, especially during an active fire scene, and getting more toward the supportive care, cooling, hydration, intervals based on wet bulb temperature and time, rather than a strict set of vital signs that may prohibit or allow a firefighter to enter the fire ground that may not be an accurate representation of their health. I don't know if the term heartburn is appropriate, but that's my take on it.
Well, it's a term I've used over the years. It's probably not the best term for this, but I'm just referencing NFPA 1584, which is part of the 1500 standard, which is occupational health and safety for firefighters.
Sure.
The initial, this is what they expect to be done on rehab is initial physical assessment or overall impression. How do they look? Vital signs, hydration, temperature, cooling, liquid, and nutrition. All of which were in Newington's protocol. And there wasn't really specific parameters for the vital signs. And if 1584 does have some specifics, that's specifically a temperature over 100.5 and some other ones, but they're very vague, and they're kept vague because there are cardiac issues are a big part of life for firefighters, and the majority of firefighter deaths are cardiac related. So there are a lot of firefighters that may be on hypertensive medications, and the blood pressure isn't the best indicator of that. But just there seemed to have been a disconnect, which because Newington, the town, even though it was done by Newington Volunteer, now Newington EMS, had one of the more robust programs in the area. And when in 17 that letter was written, that pretty much it was like, okay, you guys are done. It just seems, and this is more from my background, as Chief Tromro can tell you. I have been a firefighter, both volunteer and as professionally. I've also done rehab and been in emergency incident rehabilitation for some very large scale events that have lasted many operational periods. A lot of woodland firefighting we provided support for. So it's an issue that where it seemed like I wasn't sure if the decision was arbitrary, because EMTs are capable of taking vital signs. I know that it's not the best indicator, but it is an indicator. It's just a matter of making it safe for the firefighters in town, and not just firefighters, but you could have a long duration incident. Say you have a train wreck of a passenger train and a cargo train. That could last for 4 to 5 operational periods, which is close to 96 hours. You're going to have DOT workers, you're going to have Amtrak police, you're going to have local police, you're going to have state police, you're going to have NSTP. A lot of them are going to be working, and depending on the time of year, there's stresses, and a robust rehab program that supports the responders that are in town.
Glenn, I don't want to cut you off. I want to just say that none of the decisions I make from a medical control perspective are arbitrary. There was some thought that goes into it. I'll let Dave make some comments. We haven't heard anything regarding this since that initial conversation, which if you said it was 2017, I think that makes sense to me. If you'd like for us to review that again and meet with you or any representative from the fire department, that would be okay with me.
Well, I'm just a representative on the town committee. This is up to the ambulance and the fire department. It's just a concern, having been a firefighter, having been an EMS, and just an overall concern for responders that respond in Newington.
Yeah, certainly. And I don't, I would want anybody that's operating on the fire ground to be safe and healthy and have the best care possible. If that's something that you'd like us to re-review, then Newington EMS can certainly get in contact with us. We're always available to discuss things like this. We haven't, unless Dave will correct me, we haven't heard about it again since that time. So if it has been an issue, it hasn't been brought to us. So if that's the case, we can readdress that at any time. Dave, Scott, and numerous other people on this call are in pretty close contact with us. I saw Scott last week, 2 weeks ago.
Yeah.
So I'm here for you with anything I could do. Taking care of your providers is certainly my #1 priority. So
I can
I'd
get
like to
a little
readdress it
bit
at any
more.
time.
Yeah, Dave, you had your hand up. I tried to talk to everybody. If you wanted to say something, Dave Bailey.
Yeah, absolutely. So I just wanted to, Glenn, you made a comment about wanting to hear the background of this decision. There's really two levels of decision here. One is from the state level and the state protocol subcommittee. So I co-chair the state EMS protocol subcommittee. And I was in that position when this protocol was reviewed and discussed. The issue becomes, and this was really very broadly debated across at the state medical advisory committee level. So this was a number of physician medical directors from a variety of different hospitals, including some who have been actively involved in research on firefighter rehab and rehab in general. And overall, the consensus was that there is no literature support for clear-cut vital sign cutoffs or safe return to work criteria based on objective standards. That we couldn't say that there's any kind of, hey, if you have this set of vital signs, you're safe to return to work. So what we would end up with is a very subjective evaluation by the paramedics, which puts them really in the hot seat without the appropriate training. Paramedics are not trained for OC health type decision-making, return to work type decision-making. They're trained on identifying life threats and treating life threats. So to ask them to subjectively decide, is this person safe to return to work, it's not really within their scope. So the decision was made at the state level that the protocol would reflect an approach whereby we give food, rest, rehydration, warming, cooling, address the needs of the firefighters so that they're recovered to return back to work, and have medical staff readily there to respond to any complaint. So if the firefighter complains of any issue, that they would be evaluated and offered transport to the hospital. But that, again, barring any good literature or support for objective criteria, they really couldn't decide on anything that would be appropriate for medical monitoring. And you comment on the NFPA standard, and certainly there are vital signs listed in there, but those really are just expert opinion from the authors of the document, that there is not literature support that those vital signs are sensitive or specific for safe return to work.
Well, I'm familiar. I'm familiar with 1584. There's also another standard that actually folks don't reference often. Is there's a EPA standard for hazardous environmental conditions, both cold and hot, which actually has some literature and medical behind it. We use that at a federal level for the National Forest Service. So that also, as the doctor mentioned, that gets into wet bulb temperature, work rest cycles. And we also use that when we support military events because they have a whole different OC health. This is just a concern because, they had a decent program here in town for the firefighters. Vital signs aside, it's not so robust anymore. I just want to make sure that our responders are safe.
Sure. If I could ask Glenn, what's the current process now that's in place? What does it consist of?
They send an ambulance. Is that right, Scott?
Yes, and I'm glad Dave chimed in because I was going to pretty much give all the same points he did. Everybody likes to point at Hartford Hospitals being the scapegoat in this case, but this was shot down by the state. And the program that was written was based off of Seattle and Houston's program years ago. The problem is for 10 years, we were as an agency operating beyond our scope of practice. The state addressed it, and that was the end of it. It is not in the scope of practice for emergency transport services to work. It's been that way since, I think, Glenn or Dan, you've looked at this since '89, I think it was. An EMT that gets certification can't do anything in this state unless they have medical control authorization, which means if I'm at Newington and I go to 5 auto accidents, I have the right to work. But if I travel from Newington through Meriden, I don't have any legal right. I am not an EMT at that point. All I can do is give first aid. That's the scope of practice. The scope of practice is only enabled when the service you are working for the service. And that was definitely, when this was brought forward, there were all types of memos coming out of the state offices about this. And what it did, Dave Bailey, who had worked in the state office when this first started, was a proponent of this happening. He liked a lot of the concepts of it. However, when it went to the state and Dr. Kamen was even addressed on it, it was blocked at the state because it's not in our scope of practice. Now, Hartford Fire Department has their own medical team. The scope of practice for them probably is different. Newington Fire Department is not a registered provider of EMS
Actually,
or even first aid services. They don't even have the rescue license anymore.
Actually, I don't believe Hartford Fire has its own whole medical team. They're still supplemental R1 at
Correct.
the EMR level. They're, and you want to talk about above scope of practice, they're using the IAFF protocol, which references 1584 as well as U.S. Fire Administration. So the only people that are doing it in Hartford are the ambulance crews that they send, because the people that pick it from support services, the rehab bus, are EMR. And correct me if I'm wrong, they really are the same thing as the old MRTs.
That is correct, pretty much. Well, like I said, I know that it was pointed out to us that it was beyond our scope of practice to do it. And that's why it was blocked, not because Hartford Hospital said no. It was reviewed by a lot of people and the state.
Yeah, and this is, may I interject?
Sure.
I'm sorry to, I just wanted to clarify. So I'm not, we certainly can look at the Hartford status quo of where that's at. My understanding is it's a little different than what's being described here. But again, we can take a look at that. But I think I just want to echo what Dr. Jandra said. We're not looking to throw up barriers. We just want to make sure that we keep the firefighters and responders as safe as we possibly can, while not putting our EMS responders in a position that's beyond their training or scope to be working in.
And I'll add to the fact that I think the vital sign, parameters there are the arbitrary part of that, any protocol that you'll find. And an EMS professional returning a firefighter to go back into an active fire scene is, besides a few parameters that can be objectively found in a physical exam, is probably just a coin flip and a guess, not necessarily based on a lot of hard data. And that's what we look for if we were making a decision to back this. Because at the end of the day, if we back it, we're saying that it's sound and it's going to keep people safe over just keeping them cool / warm / hydrated, and their nutrition and otherwise health status up to a decent level. So I'm certainly willing to have another conversation. If Scott, Dan, Dave, I want to sit down and have a talk about this, that would be certainly fine with me. I'd be open to that, to readdress it.
Chief Traumer, I know, first of all, congratulations, Newington Fire Department, new chief, James Traumer. Do you have any thoughts on this?
I'll be honest with you, this is the first I'm hearing about the discussion on the rehab. I know it was going to be brought up tonight, but I'd like to talk to Scott about this and come up with something and discuss it. And I think it's a good idea. If we need to readdress it, then we need to readdress it with the proper people and get it moving forward. But I appreciate your concern, Glenn. And I definitely, if it needs to be readdressed, I would love to have it readdressed. And that's about it.
Okay, what re-sparked this, and again, this has been going on. This was discussed around 2017 with the former chairman, Scott Woods. But what sparked it off is, again, other agencies do have this type of program where they check vital signs. But again, these are different medical control and different circumstances altogether. Might not apply to Newington.
Right, but isn't one of them a Hartford Healthcare hospital that's providing the oversight for that particular
I
agency?
believe one of them is New Britain. I did work
which
at
is
the
now
Britain
the
Hospital,
perfect.
if I'm not mistaken. I believe Berlin Fire. Am I right, Glenn?
I thought Berlin Fire does with through Hunters through Midstate. I believe
Okay, that's right. I'm sorry.
I think that's Sean Fitch's office.
Yep. So yeah, they work it, and I don't know how their policy works or and so on. But that's where this is kind of sparked again, because we are worried about the firefighters and the first responders. Does anybody else have any other thoughts? It looks like we're going to, or at least the companies responsible are going to talk about this and discuss it, and we see where it goes. Unless somebody has something new to add, we'll move on. Any comments? Glenn, Mr. Torrey, thank you very much for your input. I appreciate it. I know you put a lot of work into this.
I have nothing. I have to keep one foot up now.
Okay. Next, 6.3 communications and dispatch. We kind of went through this with the Payne road call. Any other thoughts on this from the committee members as far as changing in communications or improvement in communication? I know at some point we had a town meeting, and Scott, I don't know if you heard anything or everything's on hold about changing the communications or how we communicate. I know we went to a meeting like 3 months ago, 4 months ago.
Yeah, actually, the fire chief here probably has more information on it. Basically, the Newington communication system is well over 20 years old. He probably has more of the facts on it, and it's showing its age as everything moves forward. A consultant was hired. He's been communicating. There's a task force at the town manager's office that has had a meeting, and I believe the report is due out very shortly. And it's a long range. You're looking at an 18-month plus project, I believe, for it to take place, but it will bring the next generation of radios and stuff. So at this point, we're kind of in a hold pattern, band-aiding radios to keep us running. And that's the big thing. One point of it that was definitely a positive is that we're getting the CAD links, at least, so the computers from EMD and Newington will be direct. But as the ultimate goal will be to be able to transmit all that information to the responding units, whether it's Newington EMS or AMR or a mutual aid service coming into town. At this point, it's all just through verbal communications. And the ultimate goal is to have digital information. I know that North Central Region 3, they've been talking about this for a few years with their upgrades, where even patching to the hospitals could be handled digitally versus the noisy environment as we're running in. So it's a big project for EMS side, but it just happens to be about the same time frame that Newington is looking at updating their dispatch system overall. So ultimate goal for all the units to be able to get to the next level. And that's a long-term project. I don't know, Chief Drummer, you want to jump in for a few seconds here?
Yeah, so the study was due back, I believe it was due back to 1st of December. I do believe Mr. Chapman, the town manager, has that report, if I'm not mistaken. And it does basically, there was a consultant that came through and looked at all the radios in the town from PD, EMS, fire, Board of Education, Highway Department, and so forth. And basically gave recommendations of where we should be and where we should be going. And I believe, in speaking to Mr. Chapman, we are meeting after the first year, I believe, as a committee to discuss the options that were brought up and hopefully come up with a decision on where the town's going to go for a radio system. So it's still in a discussion phase as of right now. I know there's, the consultant did have the paperwork back, but we're just on a hold pattern, as Chief Megan had said. So hopefully everything goes in a positive direction in the beginning of next year.
Excellent.
For the Jeff, for the radios, is that phase 2 or are they thinking Terra?
They're actually going to go to a P25, either phase 1 or phase 2 system, digital system. So again, it all depends on how the consultant put. It could be a UHF system. It could be the state system. I don't know what the consultant came up with, to be honest with you. I know
Because there's
all the. Go ahead.
Hartford has a lot of under their phase 2 stuff. They've got a lot of frequencies, but they need it for the phase 2.
Correct. And a lot of the surrounding towns have already went. Weathersfield's already changed over. Rocky Hill's changed over. Cromwell's in the midst of changing over. And so is Berlin. So
And Bristol's phase 2.
yeah, everybody's changing. So hopefully a positive things in the future.
Excellent. All right. If there's nothing else, we'll move on to the next piece on the agenda. Information sharing from the members. Anybody have any information sharing that they want to discuss? Anything new? Any issues or positive things? I kind of, as we were going along, I kind of passed some of the positive notes with all the promotions and such. And again, congratulations to everybody. But anything else?
Hey, Dan, it's Charles. Jandro, would this be a good time to talk about COVID stuff? Any vaccination questions, anything like that?
Absolutely. That's a good point. I was going to try to find a way to bring that up. So thank you very much.
You're welcome.
I know there's a lot of stuff going on with that. So I'll leave the floor to you.
Yeah, I mean, if I could just take a minute to say thanks to everybody that's out there putting in the work. You know, we're back up to the peak of our, we'll call it COVID 1.0 or the first wave, right? We're back up to the peak of that wave, right? In COVID 2.0. If you think a year ago, we didn't really know what COVID-19 was, right? And how much our lives have changed, how much our practice has, the way we practice has changed, but yet taking care of the patients, we're still meeting / exceeding the standard of care, just with more PPE and more of our, blood, sweat, and tears. So I just want to say thanks to everybody that's on the line that's doing the work, doing a great job, taking great care of patients, hopefully in turn, keeping yourselves, your partners safe, your families safe, because that's the difficult part. So I just wanted to give my thanks to you guys that are putting in the work for sure. Besides that, I'm available to answer any questions you may have about, COVID, vaccination, anything I can help with, I'm here.
Okay. Thank you very much, sir. Thank you very much for your hard work there at Hartford. I know you guys are working hard down there in the ER and everywhere else, actually, for that matter.
I got to escape today and do some field EMS work, so it was nice. It's refreshing.
I bet.
Yeah.
Anybody else? Any other comments or anything that they want to ask about the vaccine or as far as anything else related to COVID? I know there were a couple of changes in a couple of the hospital systems that we use, but
I don't want to hijack the meeting. I just want to say one other thing about the vigilance. It seems like we're getting fatigued, right? We know what we need to do: social distancing, masking, keep our source patient control with a mask. It's in these next weeks, 2 to 3 weeks. I think we really need to focus our efforts on that. Vigilance when you're, in the crew rooms, in the EMS rooms, in the common areas is where we really have to police ourselves and make sure that we're masked, social distanced, washing hands, doing all the things we know to do, but we're a bit fatigued from the last 10 months or so. So please, that would be my ask in the next few weeks. The final push before the vaccination, takes hold and we start headed in the right direction. I think the next couple of weeks we're going to continue to head up in the wrong direction, but through vigilance, I think we can get there as a team. So that's my ask.
yeah, absolutely. And I think both town agencies and all the town agencies and the medical personnel that have done that and enacted policies to make sure everything is safe. The last time we had a Hartford Hospital meeting, a couple of weeks back, Dave, if you remember that, one of our assistant chiefs said that everything is fine and nobody's been exposed yet. And 2 days later, but nothing came of it. Everything was good. So, any other information sharing? We'll move on. It's getting close to an hour here.
I have to say that the work that was done, it was kind of not seen by a lot, but I know Dr. Jandro and his staff, I mean, we've been communicating between the field and the hospitals and the state levels. We're attending 3 to 4 virtual meetings a week during the crisis periods. And it's been really helpful for us because it's been able to get us, at least as responders, we know exactly minute by minute what's happening. And so that's been helpful. And I know that Hartford has gone back to weekly meetings with the EMS divisions and all your medical control. The state is actually meeting on a regular basis too. It's no longer quarterly. So the information's out there, which is refreshing. And unfortunately, as Dr. Jandro pointed out, we are at the levels that we hadn't seen. I think we're a little bit higher at days, and it varies by the hour, but we are at full force. And one of the things that happened in the past, when the state went into lockdown 7 months ago, the ambulance calls overall actually dropped. There wasn't as much transport to the hospitals. The hospitals weren't overrun. Our percentage of COVID went up, but in this time, as soon as someone in that home is getting symptoms, they're calling 911. The ambulance crews are just, everybody's tired. The numbers of transports, I think Dr. Jandro and Dave, you mentioned the meeting this week. The incoming transports are up, and definitely the walk-ins are burdening the whole system. So it's, I think the numbers that you see in the media are there. Some people say it's not true and it's because everybody's getting tested, but we know that from the transport side of the business, the numbers are up. And it's just by working together that we can make this happen.
Absolutely. And also, John Quinlaven, who is works at St. Francis. Also, thank you to you. I know you've been kind of in the background, but St. Francis has also been doing tremendous work as well. And I want to make sure that you're in on it as well. Thank you.
Thank you for that. Appreciate that comment.
All right. If there's nothing else, we'll move on. I think we're almost at the end. Yes, public participation. I'm not sure if there is any other public participation.
Nobody's joined us.
Okay. Anybody would like to speak? I think it's our town manager, I believe, joined us.
Hi, guys. I hate to join you late, but I wanted to get to you on a couple of things. If I may just interrupt your meeting, can I do that?
Absolutely, sir. Floor is yours.
Okay. I just found out, I guess it was last Friday, that there's a problem with one of the roofs on your building that's leaking and causing damage, and you can't use part of the building. I have to apologize. This is the first I've heard of it. I think the problem was reported prior to my coming, and it was never really addressed. So I asked Paul Boutat to get onto it real quick and work with your staff to figure out what to do, how to fix it. I think he's already talked with some of the leadership, if I'm not mistaken. Okay, Scott's indicating yes. So, I don't know why this has happened, but it's not the first surprise I've had since coming back. So I want to let you know that we're working and hopefully get that resolved. And the other thing, I just wanted to thank all of you for all of the work you do. And, I know that you're exposed to COVID-19 probably more than any other group. And I know it's, you've got families you got to worry about. And I just hope you all stay as safe as you can and enjoy your holiday coming up. And, we'll see you after the new year with the budget and so forth, and we'll go from there. I know at one time we talked about renovating one of your old ambulances. Was that ever done?
It's a current act in progress. So we'll,
Okay.
like you said, first of the year, we got lots to talk about and a lot of exciting things, and hopefully this COVID thing goes through. I did want to, while the town manager was here, I know that he's been kind of quiet, but I don't want us to forget our first responders, because the police department has been instrumental in getting us the information as soon as they get on scene. And I have to give a big kudos to our first responders out there, getting us the information and keeping us safe. And I know that they're frustrated with the PPE and everything else going on, but I think this is, we've seen it in the systems around us and in Newington, everybody just working together. It's if nothing else, it has brought a lot of the services closer than we had worked in the past. And
Yep.
want to appreciate that.
Okay, well, I don't want to hold you guys up, so I'm going to check off, but I just want to let you know, have a good new year, and we'll see you after the 1st.
Thank you, sir.
Okay, thank you. Bye-bye.
All right, no further public participation. I call for adjournment, I guess. Thank you, everybody, for participating and sharing your thoughts. I appreciate it. Hopefully, I think this has been positive and productive. And thank you again. Have a great holiday. Do I have a motion?
I motion that the meeting be adjourned.
Second? Second? All right.
I'll second.
No, we already got one. We're good. All right.
Wake up, Matt.
Thank you. Yeah. All right. Thank you very much. Thank you very much, everybody.
Take care, guys.
Thank you.
Thanks, guys.
I guess I did forget something. I forgot about the next meeting. Oops, that's all right. Well, I'll send everybody an email.
Okay.
Oh, just Carol's on that meeting.
She called me at 4:30. I was busy getting rid of my report today.